All right, ready to decode some squiggly lines? You sent us this article, Go with the Flow.
Yeah, go with the flow. Clinical importance of flow curves during mechanical ventilation. A narrative review, to be exact.
Right, of course, the full title. Haha.
It's a fascinating look at those lines on the vent screen.
The flow curves.
Exactly. They can tell us so much. Published in the Canadian Journal of Respiratory Therapy back in 2020. Doctors Hamahata, Soto, and Dowd.
Okay, so not exactly light reading.
No, but it's worth digging into. Most people, they just focus on the numbers.
Title, volume, pressure.
Right, but these curves tell us how air is actually moving.
So not just how much, but the speed and direction, too.
Exactly. Imagine watching a river, right? The current tells you about what's happening beneath the surface.
Okay, that's a great analogy.
Flow curves do the same thing for breathing. They can even reveal things that other measurements might miss.
So they're like a secret language telling us what's really going on.
I like that, a secret language of the lungs.
So let's decode it, starting with the basics. The article breaks down the different phases of breathing
Right. Inspiration and expiration, yeah.
and how those phases show up in the curves. What can we learn from the expiratory curve?
Well, normally expiration is passive,
The lungs just naturally recoil.
like a stretched rubber band.
Yeah. But if that curve looks weird,
Unusual, right. It can point to problems.
like air trapping.
Exactly, especially in conditions like COPD.
Air trapping? What is that?
Well, it's when air gets trapped in the lungs.
So they can't fully empty.
Right, so each breath starts with leftover air.
Oh, like trying to inflate a balloon that's already half full.
Exactly. Imagine how hard you'd have to work.
Makes sense. So the expiratory curve shows us how efficiently the lungs are emptying.
You got it.
What about the inspiratory curves? Are they just as telling?
Oh, even more so. Because they can have different shapes depending on the type of ventilation.
Okay, so we're getting into the nitty-gritty here. Tell me more.
So you've got your decelerating waveforms.
Which start fast and then taper off,
It's like a sigh, yeah. Common and pressure-controlled ventilation.
Okay, I'm following. And then there's the constant waveform.
Right, or square waveform, where the flow stays steady. Typical for volume-controlled ventilation.
So two different ways of delivering breaths, two different shapes on the curve.
Exactly.
This is already feeling like a fingerprint, unique to each situation.
That's a good way to think about it.
But it's not just the ventilator settings that affect the curve.
No,
Right.
not at all. The patient's effort matters too.
Makes sense. And how easily their lungs inflate.
Lung compliance.
Right, lung compliance.
Right.
And how much resistance the air encounters.
Airway resistance.
So many factors.
It all plays a role,
Okay, so each patient's breathing has its own personalized signature.
basically, yeah.
But how do clinicians use this information at the bedside? I mean, how does it translate to better care?
Well, for one thing, flow curves can help calculate tidal volume.
Which is crucial, right?
Absolutely.
Yeah.
But most vents don't have a built-in spirometer to measure it directly.
So how do they figure it out?
They calculate it from the flow curve.
That's pretty clever. What else?
Flow curves are also key to triggering and cycling.
Wait, so determining when the ventilator starts and stops a breath.
Yes, exactly.
Huh, I just assumed the machine did that on a timer.
Nope. Getting the timing right, so it's in sync with the patient's own breathing, is crucial for their comfort.
I can imagine. It'd be awful to try to breathe in and the ventilator doesn't give you any air.
Exactly. That's called an asynchrony,
And the flow curves can help spot those.
like a red flag.
What other red flags can they show?
Air trapping, which we talked about earlier. And they can reveal things about the mechanics of the lungs themselves, like how stiff they are.
Hold on, a squiggly line can tell you how stiff someone's lungs are.
It can. Some ventilators use a technique called the least squares fitting method to calculate lung compliance and resistance from the curves.
No extra tests needed.
Wow.
Nope.
It's all right there in the curves.
Incredible. Okay, let's go back to those asynchronies. You said they're bad news, but how do they show up in the curves exactly?
Well, there are a few different types, and they each have their own signature in the curves. Imagine you're trying to open a heavy door, but it's stuck.
Okay, I'm picturing it.
You push, but nothing happens.
So frustrating.
That's similar to mistriggering.
So the patient's trying to breathe in, but the vent's not responding.
Exactly. They're putting in the effort, but no air is coming in.
That would be terrifying.
Now imagine the door swinging back and hitting you in the face.
Ow. Okay, I see where you're going with this.
That's like double triggering.
The ventilator cycle's too early?
Right. The patient's still trying to breathe in, so they trigger another breath before they've fully exhaled.
So mistriggering is the door not opening, and double triggering is the door slamming back too quickly.
I like it. Perfect analogy.
Are there any other types we should know about?
Yeah, there's early cycling and delayed cycling.
There's some like timing issues.
Exactly. Mismatches between the patient's effort and the ventilator's timing. It's like the door opening before you've pushed it all the way or staying closed even though you're still pushing.
So many ways for things to go wrong.
But the flow curves can help us catch these problems early on.
That's good to know. We've also talked about how these curves can help calculate things like lung resistance.
Right, remember Poiseuille's law from physics.
Oh boy, that's going way back. Something about fluid flowing through a tube.
Yes, and the pressure needed to push that fluid depends on the tube size and the thickness of the fluid.
So narrower tubes need more pressure.
Exactly. And it's the same with airflow in the lungs.
Okay, I'm starting to see the connection.
Narrower airways, because of things like bronchospasm or mucus, will need more pressure to move air. And we could see this in the flow curves.
So if someone has high airway resistance, what would their curves look like?
We'd see a wider flow pressure loop.
Wider loop, more resistance.
Exactly.
And we can even use these loops to see if treatments are working right, like bronchodilators.
Absolutely. If the bronchodilator is doing its job, you might see the loop change shape, the expiratory flow might increase, and things like air trapping could improve.
So it's like a before and after picture for your lungs.
I like that.
This is incredible. These curves are like a window into the mechanics of breathing. But reading them and spotting all these subtle patterns, it seems like it would take a lot of expertise.
It does take practice and training.
So how do clinicians learn to do it?
Well, there's some great resources out there, like online ventilator simulators.
So they can practice interpreting different scenarios in a safe environment.
Exactly. And as technology advances, who knows what other applications we might discover for flow curves.
Okay, now I'm really intrigued. The article hinted at some exciting possibilities, like predicting weaning success.
Yeah, that's a hot area of research.
Imagine being able to look at the curves and tell if a patient is strong enough to breathe on their own.
That's the dream.
Yeah.
It would revolutionize how we manage weaning.
Fewer complications, shorter vent times, a faster return to normal breathing. That would be amazing.
No doubt. And there's also a lot of work being done on using flow curves to more precisely calculate airway resistance.
We talked about that earlier. Why is that so important?
Well, if we can detect subtle changes in resistance in real time, we might be able to identify problems much earlier.
Before they become serious.
Exactly. Early intervention is key.
Catch it before it becomes a bigger issue.
You got it?
This is mind-blowing. I had no idea how much information was hidden in these curves.
It's a whole new way of looking at breathing and respiratory health.
It really is. Now, the article mostly focuses on adults.
Yeah, that's where most of the research has been done.
So what about kids? Are there any differences in how we interpret flow curves in pediatrics?
That's a great question. And it's really important to remember that children are not just small adults. Their airways are much smaller and more delicate, and their breathing patterns can be more variable.
So we can't just apply the same rules we use for adults.
No, we have to adjust our thinking. For example, children's airways are more prone to collapse. We have to factor that in when we're looking at their flow curves.
This whole area of pediatric ventilation and flow curves sounds like a deep dive all on its own. It
Yeah.
really is a whole other world. So for our listeners out there, what's the big takeaway? Why should we care about these squiggly lines?
Because they can make a real difference for patients.
Yeah.
These curves can help us make better decisions, spot problems, even predict when someone might be ready to come off the vent.
It's like there's so much happening that we can't see, and these curves give us a glimpse into that hidden world.
Exactly.
It also makes you realize that even if you're not a doctor or a nurse, you can still learn about this stuff and be a better advocate for yourself or your loved ones.
Absolutely. Asking questions, about things like asynchronies or air trapping can make a big difference.
Right, because you know what to look for.
Exactly.
I'm also excited about the future of flow curves. We talked about some amazing possibilities.
Oh, yeah, there is so much potential there.
Predicting weaning success, more precise measurements.
It feels like we're just scratching the surface.
I think so too. Imagine a future where we can use these curves to personalize ventilation, tailoring the settings to each individual patient.
Wow, that would be incredible.
Like a custom-made ventilation plan based on your own breathing pattern.
I love that idea.
What other possibilities do you see?
I think we'll have algorithms that can analyze these curves in real time.
Even more advanced than what we have now.
Oh, yeah. Imagine being able to detect subtle changes that might signal a problem, even before it's noticeable otherwise.
That would be game-changing, like an early warning system for your lungs.
Exactly.
This has been such a fascinating deep dive.
It really has.
We started with those simple squiggly lines and ended up in this whole other world of breathing and ventilation.
And I hope our listeners have learned something new along the way.
Me too. I know I have. We always like to leave our listeners with something to think about, so.
What do you have for us today?
Well, we talked about how flow curves could personalize ventilation, but what if we could go even further? Imagine using those curves, plus other data like genetics, to actually predict someone's risk for lung disease,
Wow.
or even how they might respond to different treatments.
That would be amazing. Moving from reactive care to proactive care.
Exactly. Preventing problems before they even start. Something to think about.
It is. Food for thought.
Well, that's all the time we have for today. Thanks for joining us for this deep dive.
It was a pleasure being here.
Until next time, keep exploring and keep asking questions.
And keep those squiggly lines in mind. They might just save your life someday.
Couldn't have said it better myself. See you next time.